Perspective on Florida Gateway College Television is sponsored by Potash Corp of White Springs. Potash Corp, helping nature provide.
Hello everyone and welcome to Perspective. This is a public affairs presentation of Florida Gateway College. My name is Mike McKee and my guests on the program today are Dr. Geoffrey Roelant. He is a surgeon at the Surgical Group of Gainesville, and we have the CEO of Lake City Medical Center, Mark Robinson, who's going to talk about some new things happening at your medical center here in Lake City. We'll talk to both of these gentlemen when we come back. Don't go away.
Checking your fantasy league?
Nah, just my 401k statement.
Nice. Where'd you find the money for that?
I just been saving a little every month.
I can't seem to save anything.
Well, what about all this? What about the money you're spending?
What money? It's gone before I can get my hands on it.
I got a pizza for a Todd.
Hey, can somebody spot me?
When it comes to financial stability, don't get left behind.
It's 547.
Get tools and tips for saving at feedthepig.org.
I like to consider FGC as my first grand campus. I never thought I was going to go back to school or have the time to go back to school. Now my son, 12 years old, is looking at daddy after so many years, grabbing his books and going to school. And he's so proud. And I'm teaching him that you continue, my son, and you do what you have to. But be a man of your word and finish what you start.
Start your journey today at Florida Gateway College.
Welcome back to Perspective on Florida Gateway College Television. My guest on the program, Dr. Geoffrey Roelant. He is a surgeon from the Surgical Group of Gainesville, and Mark Robinson, the CEO of Lake City Medical Center. Gentlemen, welcome to the program.
Thank you.
Thank you.
Mark, I want to first, start with you and talk about some changes that are going on, some expansion. I guess in May, you broke ground on a facility expansion. Explain to the folks about that.
Yeah, it was some pretty exciting stuff going on for this community, certainly, and Lake City Medical Center. We are very, very fortunate to be right in the middle of a $9 million expansion of our emergency department. Currently, our emergency department is 11 beds, and we'll be doubling the size of it to 22 to help better accommodate all those who choose to come to the medical center for their needs. And also we'll be expanding or adding to the hospital some square footage to have a cardiac catheterization lab where in the future we're going to be looking to do some cardiac intervention. So a lot of good stuff going on.
Now, for those who are not familiar with the medical center's setup, you had the cardiac cath lab was away from the actual medical center, which wasn't always the best.
Exactly. Right now it sits in our cardiac building, I'll call it, which is shared with the Cardiovascular Institute physicians who are also from Gainesville. And it just makes more sense to us to attach that to the hospital to be able to provide more acute cardiac care.
Now, in addition to the expansion and the construction that's going to be going on, you're also going to be adding employees when this facility is complete. And I guess you told me sometime this spring, in spring of 15?
Absolutely. Right around March of 2015, the construction project will be finalized and we'll be running at 100% with new employees, with an expanded hospital and some expanded services.
With that comes expanded services, which is a reason we have Dr. Geoffrey Roelant, who is from the Surgical Group of Gainesville. Dr. Roelant, welcome to the program. And
Thank you.
let's talk. You're a surgeon.
Yes.
And your services are going to be in Lake City from now on. In fact, right now, if a patient has being referred by their primary care physician for surgery, you're the guy.
So yeah, this is something new for us as a group, as we've primarily been out of the Gainesville office, but with North Florida in conjunction with Lake City being North Florida healthcare, we are now up here to offer full service general surgery in Lake City, everything from gallbladders to hernias, emergency surgery to elective surgery, so that people don't have to make that long drive down to Gainesville to see their loved one who's going through the healing process.
Well, let's talk about gallbladder surgery.
Mm-hmm.
Not a typically emergency procedure, but you need to have a surgeon here locally that can do it, and you.
So gallbladder is the most common surgery as general surgeons do. A fair percentage are emergent in that they are infected, and we have an acute cholecystitis. Those are the people who have intense right upper quadrant pain, start feeling sick and fevers, and those need to be taken care of right away. But a lot of people suffer from symptomatic cholelithiasis or just a gallbladder dysfunction called biliary dyskinesia, and need their gallbladder out electively to improve their quality of life. And now we're offering that up here so people don't have to make that trip down.
Well, let's talk about that. You got to go all the way to Gainesville. Mm-hmm. Now, you don't just go, all right, I'm having surgery, I'm just going to drive to the hospital and have surgery. There's some things that you have to do before that. So there's like a pre-op. Take the patient through what they would normally have to do going to Gainesville versus having it all done here.
So, So if you want to come in for an elective surgery, the surgeon has to see you in a preoperative appointment. If you have other comorbid conditions, heart failures, COPD, anything like that, we often have you see a medicine doctor. So now you're 2 trips in, and that's before you even make the trip down for the surgery. And typically we do like to follow up with our patients at the office that they see us at. So now you're 4 trips in. Whereas now we have everything here in Lake City. You can come see us. We have an office right across the street from the hospital. You can do your preoperative appointment there. We have the hospital is here that you can see for your preoperative clearance. The surgery is done right at Lake City Medical Center. I mean, it's the same surgeons. I think we have great staff. The OR equipment is exactly the same. And then no long trips and post-operative appointments with us up here.
Let's talk about the North Florida Regional Health Care, Mark, and this is a combination of the Lake City Medical Center and North Florida Regional, and you kind of partnered. I mean, I'm thinking, just talking to Dr. Roelant here, how stressful that is. Having surgery is stressful, whether you don't know it or not until you're having to have it done. Now you've got to take maybe 2 trips. You got to spend gas to get down there. You're going to maybe have a friend take you, a loved one take you. Now it's really thoughtful of the North Florida healthcare.
It is. I mean, even thinking of it from a consumer's perspective, I have a community hospital here in Lake City, and that's Lake City Medical Center, and I want to be able to have done to me as much as Lake City Medical Center can handle, so I want that to be close to home. And I think people are very in tune to having services close to home. And that's our goal at Lake City Medical Center is we want to be a provider that allows folks to stay in their community to get services that they could get at a larger hospital. And sometimes folks attribute larger to better, but that's certainly not the case. And that's part of the reason we wanted to acknowledge our affiliation, and it's been a long-term affiliation with North Florida Regional Medical Center under the brand North Florida Regional Healthcare. We understand that as a partner with North Florida Regional Medical Center, we have access to physicians like Dr. Roelant who are now spending time in helping our medical center evolve into one that provides more acute services and more services that, again, will keep people from having to drive 50 miles, valet park, and keep them out of the fray and have them focused on their loved one and their surgery of that day. And that's what we do at Lake City Medical Center.
And it's good to know that you have that backup if there's a problem that and maybe Dr. Roelant can explain the difference between having a trauma center where you have
Sure.
like open heart surgery and you have brain surgery and you have stuff that actually couldn't be done here. The reasons you can't do them here is because of staffing, and bigger hospitals have that staff to take care of those problems.
Yeah, well, common things being common, most common surgical things we can take care of in Lake City without any difficulty. Really, the handful of specialties that are just only available at a large center, or people who have going to be very sick afterwards or have a surgery such as it would have to be like a pancreatic or liver resection, to be honest with you. Most colon resections, small bowel, thyroids, hernias, gallbladders, appendixes can all be done in Lake City, I think, very safely and effectively. And it's only the really sick people, I think, would need to go down there. And we have the ability now with our partnership with North Florida and Lake City that if we know that you would be better served down there, that we have the ability to easily transition your care down there. Whereas if we can do it up here, we will take care of you here in Lake City.
How important is that, the continuation of care, Mark, that you have, say someone's got they need a heart cath and they have it done here.
Sure.
as they get older, some additional problems occur, the continuation of care that North Florida provides and can provide through the physicians at Lake City Medical Center.
Well, you know, the great thing about it is that people in this community have trusted Lake City Medical Center as their first line of we'll call it medical defense, their first line of care. And I've always said this, and I say this to my new employees, and I say this to the community, is that Lake City Medical Center does two things very, very, very well. And that is, number one, we take care of the folks that we know and that we have the capacity to take care of. We know the limits of our service at Lake City Medical Center. And number two is, if we can't perform that procedure or feel that it's not necessarily safe for a procedure to be done in Lake City, we can get folks to North Florida Regional Medical Center very fast, and to physicians like Dr. Roelant and his group, and you know, the Cardiovascular Institute or whoever else that can take care of that patient and take care of them timely.
Dr. Roelant, you're part of a group of surgeons that do just about every type of surgery.
In the general surgery world, yes.
And general surgery can be biopsy.
Yeah.
Talk about that. And that's not just cutting someone and then going into doing the biopsy. It's basically laparoscopic.
Yeah, so I mean, a majority of the group, we try to do everything as minimally invasive as possible, doing laparoscopic surgery. If you need a biopsy done that is, you know, superficial, a breast biopsy we can do here, we can do all your breast care here, as well as if you had some sort of intra-abdominal need for a biopsy, we would try to do that with only the two very small, sometimes three very small little holes, so that you save that morbidity of having, you know, a big open incision, and you recover faster with less pain. And I also wanted to go to Mark's part with the having North Florida and Lake City together, is from a physician standpoint, now we all know each other, we're in the same system, we share the same electronic medical records, so having most of your care done here, and then if you have to go down to North Florida for anything specialized or anything like that, it makes it very easy for the physicians to get on the know exactly what's going on, who you are, what's happened to you, and we don't have to keep reinventing the wheel every time.
Well, how important is continuity? You keep hearing the term continuity of care. Everybody needs to be on the same page, and that's part of what you're talking about when you're in the North Florida regional system, correct?
Absolutely. And I think continuity of care is a very big thing from a physician standpoint, and just because, you know, from a surgical standpoint, I take care of you for a very short period of time, usually getting you through that illness that you have, and then you have your primary care provider who typically oversees everything and is your continuity of care and can help me know you better and what, you know, would be good or bad for you, as well as being able to work with a cardiologist who may follow you long term if you have heart issues, or a nephrologist if you have kidney issues.
Doc, I'm a chicken. I mean, you mentioned laparoscopy. If I'm going to be able to do something, I don't want to have to go into a lot of recovery or a lot of pain. And I guess most patients are chickens, basically. That they don't, you know, if I'm going to die, I guess I should have to have the surgery.
Yeah.
But you're talking laparoscopic. You can do some of these procedures, and the patient can go home right away, correct?
Yeah, it's, you know, typical hernia repairs that we do laparoscopically, whether they be inguinal, the ones down in your groin, some of the ventral ones that aren't too large, gallbladders, we can do those typically through about 3 or 4 small holes. You'll be sore, but you're going to be able to go home that day, and you're going to be able to recover in your own bed, and you're going to get some sleep, because, and I like to tell all my patients, a hospital's a great place to get care, but it's not a very good place to recover, because we are constantly sticking you for blood, waking you up to check your vital signs. It's not a great place to get some rest.
And Mark, talk about that too. The fact that if there is a surgery that can be done here, say a hernia, say you're a young man who's done some heavy lifting and you got that hernia and you got pain, and you talk to your primary care and he says, you know what, you may have to have surgery. The fact that you don't have to go to Gainesville, your family doesn't have to go to Gainesville, how important is that as a CEO of a company, that you're making your customers as comfortable as possible?
You know, and I don't necessarily look at it as business and customers in that perspective. I look at it again from the consumer's perspective, and being able to take less time out of my life to get the same level of service that I would get at a larger hospital in a larger town or city is just that much more important to me. And as a CEO of the hospital, it's really my job to make sure that we've got the foundational services like general surgery, and that not only they're foundational, but that we have very, very good physicians that have quality outcomes and that take care of patients. Because I agree with Dr. Roelant, we don't want folks in the hospital. Our job is to get you out of the hospital as soon as possible, and that's what we're looking to do.
And Dr. Roelant, is it true that when the patient's not worried about several different things, the healing process can start and is more effective? I mean, I know there's studies have been done about, you know, having someone at ease and they do much better.
Yeah, I mean, clearly if you're in the comfort of your own home, or if you're with loved ones around you that can help take care of you and make you more comfortable, you are going to heal faster. You're going to be encouraged to get up and move more. And there are studies that do show that there are less infection rates. People tend to recover a little bit faster, spend a little bit time less in the hospital, which also lowers their bill too, if they have people there to help them out.
Well, and I want to talk about the ER. Mark, you mentioned that the ER is expanding to 22 beds. I know that a lot of times folks they go to the emergency room because it's immediate. They've got a gash in their head, or they've broken a leg, and they don't really want to wait. And Lake City Medical Center has been proactive in getting more beds so more people can be seen quicker.
Yeah, the expectation that anybody has with an emergency room is that I can go there, get diagnosed, and either get fixed or move on to a higher level of care, and whether that's admission or potentially transfer because I'm really, really sick and we can't handle it. But the expectation is that you can get the care. And having, just talking about general surgery and cardiology, for example, two foundational level service lines for any facility, and being able to provide that service 365 days a year, 24 hours a day, 7 days a week, is what we are tasked as a hospital to provide to this community, so that you can rest easy knowing you come to the hospital for a service and that we can provide it.
Dr. Roelant, let's talk about the ER. A lot of times a surgeon needs to be there in case something happens. What type of surgeries would you do on an emergency patient? Would it be attaching a finger maybe, or maybe maybe two? I know you're talking tendons and things that may not be.
So no, usually the orthopedic surgeons do take care of attaching the fingers, and that's actually a rather advanced thing. But the more common things we see, people coming in with bad gallbladders. If you have a bad appendix, we will take care of you. You know, we'll be there and we can get it done pretty quickly. The other big one is we have what we call intra-abdominal catastrophes. People have a perforated viscus, whether it be the colon from diverticulitis or a duodenal ulcer that perforates. That is a surgical emergency, and we need to get you fixed fast. And we have that ability at Lake Center to do that, and we have the skills and the people that can take care of you.
So you're talking about an ulcer that someone having a bleeding ulcer to where they can't handle. They've probably been maintaining it with Nexium or whatever they've been or Tums or something like that, and it gets to the point where they can't handle it anymore. A surgeon can fix that problem at Lake City.
We can fix that problem. Typically, most ulcers actually can be treated medically. It's when they perforate, particularly if you take a lot of what we call non-steroidal anti-inflammatories, which include ibuprofen, aspirin, naproxen, sodium. Those things can make you get ulcers, and if we're able to treat it medically, initially, usually we can get them better. There's also a bacteria called Helicobacter pylori that causes ulcers, but if those ulcers perforate and you start having air outside of your stomach or your small bowel, that is something that needs to be treated right away.
Mike, and if I may, real fast, you know, the ER, it's certainly an interesting process, and what we're tasked as an ER group and as ER physicians and as staff in the ER, we have to provide Dr. Roelant and the other surgeons with an accurate picture of what's going on with that patient, so that the surgeon can make a decision on whether or not, hey, this patient can be tucked in as an admission and wait for a consult in the morning, or does that surgery have to happen right now? And if it has to happen right now, and let's say 2 a.m. in the middle of the night, you know, or first thing in the morning, then there are rules that guide our physicians in how long they have to respond to the hospital, and it's usually within an hour or so, and we have to have staff on call to make sure that we can do these surgeries any time of day, any time of morning, any time of night, and that we meet our physicians' needs and meet this community's needs.
Now, and you mentioned to me before we came on the air about 24/7 surgical coverage, and that's what you're talking about now.
Absolutely.
Is that you got a person that you wake up and it's 3 o'clock in the morning and you can't handle it anymore. You call 911. The EMTs come, bring you to the medical center, and you've got.
I am guaranteed that if a surgeon is needed, that a surgeon will answer the phone when called, and that they will make the right decisions.
Okay, so otherwise they would get to the hospital and then they have to be transferred to North Florida Regional.
You know, again, that's part of the whole evolution of North Florida Regional Healthcare is us being able to keep that patient here, because you're right. In the past, that patient would be, our staff would work them up, the ER physicians would look at them, and then we would say, wow, we don't have that service right now, so we need to transfer you. Then again, another 50 miles down to Gainesville and worked up again, and we could get into the whole utilization of resources and things like that.
And time, and I'm sure Dr. Roelant can talk about time in certain instances. I know in stroke protocols the time is very, very important. And if you've got someone who's bleeding internally, or you got time is all of the essence.
Bleeding, people who have something called sepsis, I mean, time is of the essence to get the proper treatment right away, and being able to take you emergently to the OR if we need to, whether it be 2 or 3 in the morning. If you need our services, we're there to provide it, that we can get you better faster and hopefully prevent you from getting sicker.
Hearing this today on our program, it kind of, if I was a patient out there, I would be a little more relaxed about, if I do have to go, I'm not going to have to be, I guess they call it triage at the hospital, and then I've got to go somewhere else. Right. It can all be done in one place.
Right. No, that's exactly right, and that's our goal at Lake City Medical Center, is to make sure that one, we're providing the services needed, but number two, that we're doing it right, so that we don't really, that we can prevent bad outcomes by rushing into something and not doing it to the best of our ability. So again, as I talk about the natural evolution of acute services at Lake City Medical Center, you're going to see us doing this more over time and adding things to this hospital that keeps this as a one-stop shop medical center for the folks of our region.
Well, and I want to tell the folks too that if you've ever been to the medical center, if you've had a loved one in the medical center, you notice behind the hospital there's a big square with a circle on it and some lights and some flags, and there's a helipad at the hospital. And if Dr. Roelant sees a patient, I mean, you're immediately getting, depending on the urgency of the it's right there. Yeah. And you're less than probably 10 minutes away. I don't know what the time is, but if it's 45 minutes to drive on I-75, I'm sure it's 10 or 15 to get down to North Florida Regional.
It's a lot quicker. No, absolutely. I mean, you talk about time, and typically when you're talking about time and medicine or time and emergencies, time is typically not on the side of the patient, so we have to do everything we can to get that time lower and lower, and having access to be able to land a helicopter for those truly emergent patients that need a higher level of care, we can get them where they need to be in less time than it would take for an ambulance to drive them.
Now, Dr. Roelant, you're going to be up here once a week, or how does that work?
So
the surgical group of Gainesville will have your guys who are going to come up.
Yeah, so we're doing a week at a time. We typically come up on a Sunday afternoon. We stay to the next Sunday, and then we hand off to the next person. There's always going to be somebody here that will be able to offer surgical services. We've really enjoyed our time here. I think the staff has been great. The ORs are pretty much the exact same as we have down in Gainesville. And it's just a nice place for us to be and a good service for us to offer.
Now, I wanted to toot your horn a little bit. You specialize in obesity patients.
So, yeah.
Let's talk a little bit about that, because that's a specialty that you could do. But talk about the surgeries that you're involved in to help people who just can't lose weight.
So yeah, we have a couple different options, and it's one of the things. We have a Center for Obesity at North Florida currently, that we offer from band to laparoscopic sleeve gastrectomy to laparoscopic room-wide gastric bypass. And what these surgeries essentially do is they're restrictive, and that makes it so that you can't eat as much, or in the case of the gastric bypass, it's also what we call malabsorptive, where you can't absorb all your food, with the goal of making it so that you eat less and that you're able to lose some of that weight that contributes to those comorbid conditions of diabetes and hypertension and bad cholesterol that we have. So, and there's a number of us that do that, and we're happy to see people down there for that. And we also, my other specialty being, is I try to do everything as minimally invasive as possible, whether it be pancreatic resections or stomach resections.
I know you pride yourself on like the chicken in me. I don't want to have to be in a recovery room and then stay in a hospital for any length of time. You do most of what you do laparoscopically.
Absolutely.
And that's where they stick. Talk a little bit about that. You stick needles in, and you're not cutting. You're just using little holes and cameras.
Yeah. So for example, a couple days ago, we had a local gentleman who needed part of his colon removed, and I was able to do that with 2 incisions about that big. And what you're actually doing is you're inflating the abdomen full of CO2, So it gives you a little room to work in, and then you have these, they look like long sticks with graspers on them, and you work inside of the abdomen that way. But he had 2 incisions that big, 1 that big, and then I had to make one a little bit bigger to take the colon out. It sometimes takes a little bit longer, but it certainly reduces the pain that the patient feels. It reduces the recovery time. They're up and walking almost right away. It reduces the chance of them having a hernia. So I think it's a great benefit to have that done if you can, and we're doing that up here now.
Wow, that's awesome, and they're the surgical group of Gainesville, but they're working out of the Lake City Medical Center. In fact, doctor, here's the contact information. If you need anything if you want to know anything about Lake City Medical Center, that is the website at the bottom of the page. Dr. Roelant's office and Dr. Solar, who is also a surgeon in that office, is 755-6682. The 800 number is a physician referral number that operates through Lake City Medical Center. But Dr. Geoffrey Roelant, we appreciate you and your guys coming up here and making medical life for residents of Columbia County much better. In the Swanee Valley region, I think and Mark, I appreciate what the medical center is doing to make medical procedures for folks up here much easier.
It's fun. Yeah, thank you very much.
Yes, thank you.
And thank you for watching Perspective on Florida Gateway College Television. Hope you enjoyed the program. Until next time, I'm Mike McKee. So long.